my name is Kelsey. I am from Calgary, Alberta, Canada, and I am studying, or hopefully just finished, my master's designation in global health policy. I have a Bachelor of Science degree that specializes in dental hygiene, and I work as a registered dental hygienist in Calgary. I also work part-time with a nonprofit that provides services and resources to children with disabilities. I think what drew me to health policy is perhaps maybe, or global health policy is the wider perspective of it. Public health seemed a little bit more narrow for what I was interested in. I don't really know what career direction I want to go, but I've enjoyed being part of the operations of nonprofit and working in kind of a governance sector as opposed to public health. So I thought global health policy would be, just broader in scope and maybe take me in a different direction. I enjoy the on-the-ground work that a public health, background would provide, but I also like the idea of being behind the scenes in an office and making some more higher level decision making. Some of my favorite modules, I really enjoyed the conflict and health module with public health. The core modules with global health policy, those were probably my favorite, I'd say overall. I really enjoyed the wide scope of what those taught in terms of, I thought economics and politics would be pretty stuffy to learn, and I actually really enjoyed them. They were probably two of my favorites. And surprisingly the law and health policy class was also really interesting. The tutors were phenomenal. I can't speak more highly about, the support they gave, but also just where they come from in their own experience and their own education and their own research and work. And it was always admirable what they were able to, tell us about, their backgrounds or where they were working in the world and the work that they were doing and how that would relate to what we were learning. Probably a dream job would be to work for something like the Canadian Red Cross or a global NGO. I also am interested in working for a policy-related position within my provincial governing body, like healthcare governing body. So, lots of different opportunities, and that's kind of, again, what drew me to global health policy and, where I hope to take it. I would sum up my experience saying it was, probably one of the most challenging things I've ever done, but on top of that, probably one of the most rewarding. I'm so happy that I did it. There's ebbs and flows throughout the program. You're always waning on whether did I make the right decision? Is this for me? I'm going to throw in the towel. I'm just going to take one course, and pushing through, you're really proud of yourself at the end. And so I'd encourage anyone to, take on that challenge. Even if you think you can't do it, the flexibility of the program is there to make sure that you can do it, and that's what drew me in and what kept me going throughout the whole thing is that, they're there to help you, the school is there to help you, and they want you to succeed. And yeah, it was wonderful, the whole thing.